So you want to know when you can start running after you had your baby? Well, you're in the right place. Hey, I'm Dr. Bong Henry from Radiance PT, and I help pregnant runners not only prepare for a positive birth, but the top question I get from them is, when can I start running once my baby's here? So let's check it out. First, let's start with the obvious, that postpartum recovery and postpartum running is not a one-size-fits-all answer. Everybody's situation is different, and it's really important to recognize that what worked for somebody else may not work for you. There are a lot of important factors to consider in our postpartum running success, and here are some things to keep in mind. What kind of birth injury did you have? Was it an easy, smooth labor, or were you pushing for hours and then had an instrument used and then ended up having a cesarean? Those will affect your recovery. We also want to know what sort of family support you have, what sort of work return pressure is going on, because that adds stress to your mental load. We want to know how you are doing with your mental health. How are you coping with that transition of motherhood? Were you a runner beforehand? Were you running all the way up until the day you gave birth? Or is running something you did back in high school 10 years ago and you're hoping to pick it up right now? All of these things play a role in where your body is, so it's really important to recognize a personal approach is key to help you get to where you want to go. In addition to our personalized approach, we also want to consider the demands that running has on our body. And everybody postpartum has unique issues. Not one postpartum body is the same. So you want to understand what your body needs to recover to its highest level, so that way you can be prepared for the high demands of running. Running is a sport that requires balance, strength, power, coordination, pelvic floor capacity, abdominal strength, heart endurance, as well as mental fortitude. Recognizing these little key players and setting yourself up for success with a plan is exactly what I do with my clients at Radiance Physical Therapy in Durham. So one of the things that you want to recognize is that when you're choosing your postpartum support team, make sure those providers are aware of what the postpartum body needs to prepare for running. If you're an athlete who wants to prevent yourself from getting injured and you want to get back to running, feeling as good as possible in your body, you gotta use some discretion when picking your team. Talk to women every week who are struggling with pain, struggling with leakage, or worried about prolapse, or struggling with abdominal weakness, and they've been to many providers who haven't been able to help them get back running the way they want to. And at Radiance, you can expect to have a collaborative conversation of what your goals are. It's not just me telling you what to do. I actually want to hear what's important to you. I want to know what support system you have in place. And we also are going to talk about what else has gone on in your pregnancy and your labor, to recognize what are some risk factors you might be aware of if your goal is to be running pain-free, leakage-free, and not worrying about your body when you're running. We'll also look at your past medical history and talk about things like your period health, like were you skipping periods? Do you know your cycles? Lactating or not lactating will have some different influences on your cycles postpartum. So just really understanding the different things that can help set you up for success with your postpartum running when you can plan for them and having somebody support you to do them. And during that first appointment, the physical assessment will be based on what your main goals are for that first postpartum month. So you're going to be doing a lot of up and down with a newborn. So making sure that you have that, you feel good physically with that. And then we progress into running specific exercises and strengthening down the road. Depending on when you do actually get seen, we may actually check the pelvic floor at 3 weeks, typically 2 weeks or 3 weeks, typically not. but there's so many things we can work on, but just making sure, like, are you pooping normal? Are you able to pee normally? These are some things that people kind of often ignore, but understanding your basic body functions, how are they going? And having a plan to gradually progress your running can help prevent injuries that will happen if you just do too much before your body is ready for it.